Good day everyone. I'm Robert, the moderator for this webinar. I welcome everyone for today's webinar, CMS Preventive Services Medicare Patients. I would now like to introduce our presenter for today, Jan Rasmussen. Jan Rasmussen, PCS, ACS, OB, ACSGI. As a healthcare consultant, Jan has over 45 years of experience in physician billing, reimbursement, and compliance. I would now like to hand over the floor to the speaker. Over to you, Jan.
Thank you. Welcome, everyone. We're going to talk about preventive services, and yes, we're focusing on Medicare's because they're the ones that really define preventive services, what they will or will not cover. But I need everybody to remember that not all Medicare patients are 65 or older. We do have some disabled and younger patients that are Medicare. So keep that in mind as we're going through some of these guidelines. Okay, first we're going to talk about the preventive office visits 99381 through 99397, new and established patients. It does not include any immunizations. The diagnosis codes that go along with annual physicals, HMEs. You can have a prevent and a covered visit on the same day. Medicare preventive services. We've got our breast and pelvic exam, which is a GO 101, and it's payable every 2 years for Medicare patients. GO 101 is basically reimbursement is less than a 99212. If it's no longer screening, you cannot use the GO 101. What is required? To bill a GO 101, you have to have 7 elements. Also, Q0091 is billed separately for collection of a pap smear. You're out those dollars. GYN component included in the preventive medicine visit. Male preventive services. You have to be aware that there are some separate S codes out there. They're not payable by Medicare. What do we do? How do we know what they came in for? Okay, you need to pap pelvic on some of the issues. You need to know what payers will accept G codes or Q code. Well versus sick visit. How do you separate the sick level of service? Where are risk areas? Incomplete documentation to support the sick visit. Another one is reporting preoperative services as routine physicals. So now we're going to talk about Medicare preventive services, IPPE and annual wellness visit. IPPE, it's called Initial Preventive Physical Exam. The IPPE is not the same as an annual physical. It previously also required a screening EKG. Basically, reimbursement is about $166. Annual wellness visit is, again, a preventive wellness visit, not a routine physical. It's eligible for the first AWW after they have had an IPPE in the previous 12 months. Subsequent wellness visits are covered every 12 months. It can be performed by physicians, physician assistants, nurse practitioners, clinical nurse specialists. Now, a medically necessary E&M visit may also be billed in addition to in that preventive or that sick visit. Calculated frequency. Well woman exam, GO 101 and the Q0091. Prolonged preventive services, GO 513 and GO 514. Used in addition to Welcome to Medicare. Waive deductible and coinsurance. Breast and pelvic exam we've talked about. Pap smear procurement. Screening mammography. Additional CMS covered services. And I think this is where a lot of our primary care groups are missing opportunities to bill. High-intensity behavioral counseling to prevent STIs, GO 445. Hepatitis C screening. Behavioral counseling basics. Another one is ASSIST. Okay, smoking cessation counseling. It's covered for patients who use tobacco, whether they have signs or symptoms of tobacco-related disease. They allow 2 individual tobacco cessation counseling attempts per 12-month period. Is alcohol misuse. Patients that screen positive will then cover GO 443. What is the criteria for misuse alcohol but not alcohol dependent? Then we have depression screening. Must be performed in the primary care setting. CMS does not identify specific depression screening tools. Documentation. Sexually transmitted infection prevention. Visit elements. What's high risk factors, which can be taken into consideration? The diagnosis codes fall into the Z category. Here's Z72.50. 1 is your high risk. Preventing screening labs. GL446 is your cardiovascular disease risk. It's GL446, cardiovascular risk, counseling for obesity. Now, let's talk about screening terminology. Appropriate screening for preventive services. Now, immunizations, pneumococcal, influenza, COVID, hepatitis B. How can you track eligibility? I hope you will take some of these additional counseling opportunities back to your providers. So I hope you will take these back to your doctors and encourage them to document a little better on these things.
Thank you, Jan. That concludes the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead.